Conversely, when those kinds of judgments aren't made because the person understands that people have a hearing loss and it's not a matter of capacity or motivation, and people are comfortable to ask for clarification, a more positive relationship can result. And once again, the involvement of the non-Aboriginal person in understanding about hearing loss, not making judgments, is an essential component for people being comfortable in asking for clarification and being willing to pursue a relationship where they are comfortable in asking for clarification about what's been said. That's what happens on a very individual level between people communicating, and all of that takes place within a framework of institutions that are often failing in providing adequate services to Aboriginal people. Firstly, in education, teachers are not effectively trained as to how to teach in classrooms where most students have a hearing loss. The acoustics of classrooms, especially remote classrooms, is often very poor, and the combination of high levels of hearing loss amongst students, poor acoustics, and limited teacher awareness or training in how to address the needs of students with hearing loss often lead to quite disastrous outcomes in classrooms, and for the group of students and for individual students. However, the situation is even worse for Aboriginal adults with hearing loss, because there, at least in education, there's some degree of awareness, even if it isn't, if the issues are not being adequately addressed. In most other areas with adults, there is not even an awareness. For example, in terms of Indigenous employment, in the mental health system, in the criminal justice system, and as well as other areas, all areas where Aboriginal people are overrepresented in a way that they are disadvantaged, none of those areas have a full awareness of the role of hearing loss in bringing people into contact with, say, mental health and criminal justice systems, or the problems that underlie that, or the communication strategies that are important in providing services to people. In audiological services, where we may hope that there is a better understanding because of the nature of the knowledge of practitioners, the systems also often fall down. In remote areas for Aboriginal people, audiological services are often unavailable or very limited in their availability, and access often requires communication by phone or through writing, when, as we've seen earlier, communication particularly by phone with non-Aboriginal people is problematic for those with hearing loss, and people with hearing loss are more likely to have low levels of literacy. So the very obstacles created by hearing loss are the means that must be engaged with to actually access audiological services and hearing aids. And there are often multiple agencies that, with unclear boundaries from a consumer perspective and obscure rules. I don't know if many of you have seen Little Britain, but the scenario where computer says no, very often there's a similar sense in trying to engage with some of the long distance and very administratively inflexible systems around accessing suitable audiological services and products. And to illustrate that, this is a case study of a man who's we'll call James, which isn't his real name. He's 45 years old, and he's got some moderate bilateral hearing loss from endemic childhood ear disease. This hearing loss influenced his educational outcomes, his mental health, in terms of him having lots of issues around anxiety, frustration and depression through his life, and this also flowed on to his domestic life, and he'd been involved in domestic violence, and this has also resulted in his involvement in the criminal justice system, and particularly he has poor relations with police and has often difficulties around communicating with police. He also has difficulties in employment, and in fact now is quite isolated and remains at home because this is the best way that he's found to reduce some of the frustrations and anxieties. And James had been trying to get a hearing aid for over 20 years. And there were multiple attempts and multiple frustrations in this attempt, in that in accessing the private system, the costs involved were such that he couldn't afford it, and in the public system that he wasn't eligible for various reasons. And about a month ago, I loaned him a assisted listening device for a month. And after a month, I evaluated what was happening and talked to him and his family about what was happening with communication. And he described firstly that he had improved mental health. He was less anxious and more comfortable overall, was sleeping better, and was generally not as highly stressed as he had been. That there was a greater positive involvement in his family life. He was actively engaged in discussions and decision making within the family, rather than sitting off in the side, not being sure about what was being said, as happened so often in the past. Interestingly, it improved his relationships with police in the community that he was in. He and his wife both commented that he no longer felt so immediately distrustful and had an underlying aggression towards police when he met them, that the capacity to communicate and talk with them through using the pocket talker had actually helped him to cool off a little bit and to engage with police socially, and that had improved his overall relationships with police in the community. And interestingly, one of the very important things in his life was participation in hunting, and he said that the amplification helped his participation in hunting as well, that when he went hunting for buffalo, he wasn't so apprehensive about a buffalo coming out of the bushes and attacking him without being aware of it. When he went fishing, he could hear other people call out to him and he knew where they were, and he could monitor the environment in a way so he felt more safe. And hunting was a very important way for him to maintain both his psychosocial well-being and his cultural position within his community. However, a new attempt to getting a hearing aid ran into some same old problems. Firstly, he was assessed as not eligible, and then the administratively complex and demanding processes were very difficult for he and his family to participate in. However, after some advocacy and outlining his needs and the positive outcomes that had come about through amplification, there was an exemption made, and he hopefully will be obtaining a hearing aid. But it very much highlights that how difficult it is, despite a very real need for someone to obtain a hearing aid in some circumstances, despite the changes in the system that have come about. And overall, mainstream systems have not yet addressed how to provide services to Aboriginal children and adults with a hearing loss, and this neglect creates an ongoing obstacle to overcoming Aboriginal disadvantage in many areas. It can be said that hearing loss is the invisible piece of the puzzle of Aboriginal disadvantage. So Those are the obstacles and the difficulties around this issue, and we have another generation of Aboriginal children who are facing those kinds of issues in their education and in their participation in family life and creates for them in their life.